Hi, everybody. Thank you all so much for being here today. My name is Tressa Buckland. I am a Community Experience Associate with Curable. And today I am here with Ashley Kessler. She's a Curable user who is going to share with us the details of her very unique recovery story. Ashley, I cannot express to you how happy I am that you're here with us today. Thank you again for being here.
Yeah, thank you for having me. I'm excited to be here.
Of course. So Ashley, could you give the viewers some insight into your initial diagnosis and the pain symptoms that started you on this chronic pain journey?
Yeah, so about almost 7 years ago, I was in I had the best life ever. I had my dream job. My marriage was awesome, and I was in the best shape of my life. I was training for a half marathon, and I started developing pain in my hip, and I thought I just was having hip pain from running. And I went to the doctor, and we found out that I had spondylolisthesis, which is where your L5 slips forward on your S1, or it can be higher, but my L5 slipped forward on my S1 and was crushing my nerves. And through that, I developed really, really horrible chronic lower back pain and terrible nerve pain, which led me to have a surgery. And through that first surgery, a spinal fusion, it failed. And so then I developed an array of horrible symptoms. I ended up with terrible bladder pain, the nerve pain in my legs to where it felt like water was running down my legs, horrible back pain. And eventually I developed migraines that kept me in bed. I was bedbound anyways, but they kept me in bed and kept me so tied to home. And my husband wasn't even able to be at the house for many, many days, for probably about a year, because any noise would just trigger a horrible migraine and I wouldn't be able to function. And from there, I had 2 additional spine surgeries, trying to do whatever I could to get my back stable, and with hopes that, it would magically heal me.
Wow. I bet, was that trying on your marriage? Was that pretty difficult for you guys?
Yeah, my husband's pretty amazing, and I'll say that from the rooftops. He stuck by me. I was on high doses of oxycodone, and I was on antidepressants, nerve pain meds, bladder pain meds, and migraine meds. And so I was on all these medications. There's parts of that time that I don't even remember. I think part of that's a protective mechanism in our bodies that's like, you do not want to remember this. And other parts of it, I think, where the oxycodone kind of blanked out my memories. So I don't remember everything, but I was not the nicest person. And he was very, very gracious with me. It definitely was trying for a marriage, but it definitely made our marriage super solid too. So, yeah.
Wow. So that's fantastic to hear. I'm so glad that you two went through that tough period and are now stronger than ever, I feel like, because you have the beautiful baby girl, but we will get to that later because I don't want to give spoilers. Could you tell us a little bit more about, you mentioned you were on some pretty hardcore pain meds, and you had 3 surgeries. What were you trying anything else during this time to manage your pain?
Anything you could imagine, I tried. I tried physical therapy. I was going 3 times a week. At one point, it actually did help enough that I was able to try and go back to work, which was awesome. It did not work out. I ended up it was before my second surgery, and it was just terrible. But I did physical therapy. Eventually I started doing acupuncture. I saw naturopaths, trying to think of everything, massage therapy, any anti-inflammatory diet you could think of, I've tried. Yeah, I would see anybody and everybody. And, acupuncture helped eventually, just more so with connecting my mind and spirit, but nothing else really helped. It might have helped for a couple hours, but at that point I would take a couple hours of having less pain, for anything that helped for a couple hours was worth it.
Yeah, totally. I feel that when you're in just pain all the time, any minute of relief can be just love.
And that's why the oxycodone was so helpful and so addictive, right, is because it made it so that I wasn't in as bad of pain, but I was still in terrible pain. So it doesn't actually solve anything.
Yeah. So that's a pretty big realization to come to, that pain meds don't actually solve anything. And for you to get there, what was the turning point for you? When did you start looking for this mind-body connection that you found with Curable and some other therapies?
Yeah, so it was one of those middle of the night Facebook things that popped up that was like, here's Curable, it can cure your pain. And my brain was like, this is a bunch of crap. Like, no, there's no way that this app is going to help me. There's no way. But I was so desperate for, again, anything to help that I tried it. I did the free trial. And then you guys threw some sort of deal. So I was like, fine, I'll keep doing it. And at that point, I was like, I'm going to read Dr. Sarno's work. So I read his book. And when I got to the page that was all about personality traits, childhood trauma, and then some adult trauma, I was like, wow, my list is really long. And wow, I have a lot of stuff I thought I worked through that I haven't worked through. And I remember in the Curable app, it has you list out the three things. And then you go through them with the writing prompts, and it just kind of clicked in my brain that that this pain was stuck in my body, and it was tied a lot to my emotions and to a lot of trauma that I had as a kid, and a lot of just my personality traits. And so it wasn't like a one moment light bulb, but it definitely happened.
Wow. How did you reconcile, because you had these surgeries before, very invasive, medical diagnosis heavy. How did you reconcile the medical diagnosis of your pain with finding relief through mind body?
That's a really good question. I'm not anti-medicine by any means. The second surgery.
Sure, we love medicine.
Yes, you guys were very clear about that, of, making sure there's nothing wrong before you start this work. My second surgery did help. Like, my spine was unstable, and so the second surgery for me did help. And then my third surgery was to remove hardware, which also helped because I could feel my screws through my back. And so I mean, for me, it helped, but nothing, there was no pain acceptance. And I think too, with Curable, I was hesitant because as a pain patient, you're often told that it's all in your head. And then Curable tells you again that it's all in your head, but they do it in such a beautiful way of like, it's not in your head in the way of you're making it up. You're like, your pain is real, but there's synapses that have been created in your brain that are making you consistently be in chronic pain versus the doctors that would just continuously say, well, there's nothing I can do. You're just going to be in pain for the rest of your life, or wait a couple of years, or here's this injection. It was all kind of Band-Aid fixes, where Curable, and then eventually I needed more help, which Curable encourages therapy. And so I went to EMDR therapy, and combined, it was the turning point that has now drastically made my life incredible.
Wow. Yeah.
Yes.
It's really inspiring how you did embrace that holistic approach to your own health, and you became an advocate for your health in this way. And look at you now.
Yeah. Well, the mind body stuff is so interesting because once you get it, it's like something kind of clicks in your mind. And I tell everybody about it now. I've told all my providers about the app, but I've also just told them the impacts that you actually have more control of your pain than you think you do. And that's something that nobody in modern medicine has ever said that to me. It was just, it's all in your head, not here's a solution for you. So that's just pretty dramatic to me that people in the modern medicine injection world or spine surgery world, they're not looking for alternatives to help their patients.
So moving into more of the work that you did with Curable, What
Yeah.
exercises did you kind of lean on and leverage the most to help you through your journey?
Yeah. So the pain information, that's kind of where I started, was learning about my pain. That was good. But once that was done, you kind of know it, right? So I didn't feel like I needed to leverage it very much. But the journaling and the meditation were two, and still two of the most important things in my life. I haven't been journaling as much lately for a variety of reasons, but meditation is something that is every day, something that I do to calm my nervous system down. But the journaling, I think, was super helpful. And then the reframing of stuff, now I can't remember what it's called. So there was the writing, the brain exercises. Is that what it's called?
Yeah, the brain
Yes.
training.
So those were really helpful in the beginning, and I still use them. I just was thinking about this morning. I still use them in certain situations. Like right now I'm sitting. Sitting is still something that causes me pain, but I tell myself in my head while I'm talking to you that I'm safe, that nothing is hurting me, that my pain is okay, that, all these things that were encouraged in the app are things that are now just kind of part of my everyday life.
That's amazing. So it's ingrained in you, and you've retrained those neural pathways.
Mm-hmm. Yeah, but it's not something that just it doesn't just go away. It's just kind of like my personality traits that are kind of more on the mind body stuff. They don't just go away. And so you kind of have to still use these tools that Curable provided.
Mm-hmm.
And if you guys do it in such a way that it's just so fun and easy to follow too. It wasn't overwhelming, where there's other programs, or reading Dr. Sarno's book, it feels overwhelming of like, okay, well, what do I do? Where Curable was very encouraging to just give you like, okay, you can just do this today, and that's all you have to do. Nothing else. So yeah.
That's great. That's great to hear. So if you don't mind me asking, you mentioned your personality traits that were some of those listed to have a connection to mind-body pain. Could you share with us and the viewers what those personality traits you identify with are?
Yeah, some of them are things like I'm a perfectionist. I'm not a people pleaser, but I seek people's approval, because growing up, I really was trying to seek, my parents' approval or my brother's approval. I have a very type A personality. I like to be in control of everything. And I get anxious, which is kind of part of it. And the depression that I've had is very much part of it. But yeah, there's a lot of character traits that kind of lined up with the mind body stuff.
Mm-hmm.
Yeah.
Yeah. And you've been working on those, and you've now ingrained all of your mind body work and retrained those neural pathways.
Yeah.
And now I can get to my favorite question of all, which is, you shared with the Curable Facebook community that you now have a beautiful baby daughter, and this might not have been possible if you hadn't have healed. Could you share a little bit about what starting a family has meant to you in relation to your healing?
Yeah, we never thought we'd be able to have kids because of my back issues. And through the mind body stuff and through some of the therapy that I did, I just got to a place, and my body got really strong. I worked hard to have a strong body. We got to a place where we were like, well, maybe it is possible. And so we decided last summer, in the middle of the pandemic, to try to get pregnant. And her name is Scout, and she is the happiest, sweetest, kindest little girl that I've ever met in my entire life. And motherhood is hard, and it's challenging. It's a whole new level of challenge, but it's the best thing I've ever done. And now I don't have as much time to, focus on continuing my healing. So I have to take little minutes here and there and just reset myself, versus having, 20 minutes to do something. I have maybe 5 minutes. And so I've kind of continued to keep things going in my life that way by just taking little moments to myself. And I think having self-care as a mom is super important. But also, this might not have been your question, I'm really, really, really passionate about making sure that she's able to express her emotions. Even right now, I talk to her about her feelings all the time. If she's frustrated, I say, oh, I'm really sorry you're feeling frustrated. That must be really challenging for you, versus waiting until she's older, or trying to push down her feelings, telling her that everything's okay. I want her to know that our house is a safe place for her to process through that. So hopefully she doesn't ever have to go through what I went through.
Oh my God. Wow, that's some powerful stuff.
Yeah, she's awesome.
So Ashley, we're about at the end of our time together, but before we go, I do want to hear any piece of advice that you might want to give to the viewers who are going through a similar journey to yours.
Yeah, I think there was one thing I wanted to add is, in the midst of the worst part of my pain, I was bedbound and I didn't want to live anymore. And I think it's really important to highlight that with chronic pain, as we don't talk about that enough. And so I just want to encourage anybody that's watching, that's feeling that way, that it can get better. I honestly thought that my life was stuck in bed forever. And working through all of this has just drastically changed me. And I didn't believe in it. It was a last ditch effort to try something different. And now I just have this beautiful life. We moved to a small town to raise our daughter. Like, all of these beautiful things have happened in the last couple of years, because I healed and because I chose to heal. And I just want to encourage anybody that's wanting to maybe have a baby someday and doesn't feel it's possible. I am the living proof that it is definitely possible, if you are able to work through it and heal.
Wow, Ashley, I just cannot thank you enough. That was so moving. And I think a lot of people who are watching this right now are thanking you.
Well, I'm glad. I just hope that my story can encourage somebody else. I have a lot more compassion for people going through this. And I'm at a point too, Tressa, where I wouldn't change having chronic pain for anything. It is one of the best things that's ever happened to me. So, yeah.
Oh my gosh, that's moving. That's moving. I don't think you would be saying that if you were 5 years ago when you were in the midst of your pain. So congratulations to you for all the progress you have made, and for the strength you've shown, and for where you are in your life right now.
Thank you.
And to all our viewers at home, if you missed anything from this session or would like to rewatch, this video will be saved to our IGTV and to our YouTube channel, so you can catch it again there. Ashley, for real, thank you so much again. It's been amazing.
Yeah, thank you.